Hello, this is Chris from the Obstacle Doc, and today we're going to talk about glenohumeral external rotation weakness of the shoulder and its implications into impingement pain with any overhead raise or press motion. So when we look at a person at rest, a lot of times what we can start out with is just the way their arms are resting at their sides. That can give some implications into, amongst other things, potentially some glenohumeral internal rotation predisposition or external rotation weakness. So with Daniela standing here with her arms at her sides, what we might look for if we see a client who has internal rotation predisposition, again, or external rotation weakness on, say, her left arm, what you might see at rest is the arm itself will look rotated inward, the elbow may be a little bit more bent, and when you compare the two sides, there may be a little bit more space on that involved side versus the other. In addition to, because everything is kind of rotated inward and out, the whole shoulder complex, specifically the shoulder blade, is going to look like it's coming off and forward. So basically everything is rolling inward and away from her left side, whereas the other side is nice and retracted and rotated back. Now again, there may be other things that can implicate this, but for today's conversation, we're specifically thinking about shoulder external rotation deficits and how that can implicate into this presentation. So in our movement examination, one of the common things that we'll see if we have external rotation weakness is the following in a forward raise. So as Daniela raises both arms over her head, a few key factor differences that you may see with the client is the arm that is not involved will come back in a nice externally rotated position. Their thumb will typically be facing backwards. The pit of their elbow will also be rotated and or facing more backwards. And there'll be a nice space between the side of her head and neck and her shoulder line, suggesting that there is no shrug and that the ball and socket has nicely rotated through her range of motion. On the other side, what you will see instead is the following. The arm has not rotated externally, so it stays in an internally rotated posture as she comes overhead, which means you might see more of the back of her hand. The thumb might be facing the other way versus backwards. The pit of the elbow is also facing in and sometimes bent. And what you will definitely see is a shrug or an early sign of elevation in the scapula. Again, which can be happening because the arm is basically heaving itself up in the air because that ball can't spin upwardly through the rotator cuff interval as the arm is going overhead. So after we've ruled out other implications like stiffness or scapular weakness or motor control deficits, if all those are clear, we now suspect that there may be some actual rotational weakness inside the shoulder itself. All right, so other ways that we can look at this that are pretty classic, manual muscle testing, which has been around forever, is one way that we can look at specifically rotator cuff weakness in addition to those motor performance tests that we just did. So done in a couple different ways, but really basically, if you're looking for glenohumeral external rotation weakness with the client at her side, if I try to push inward, depending on how strong it is, if she cannot hold or resist against me, the arm will start to turn inward. You might see movements of flaring out. You might see early signs of shrugging, because basically the arm cannot hold that fixed rotated position. You can also test this in different positions at rest. This would be at positions below shoulder level, but if you were curious about positions above or at shoulder level, which typically makes more sense for when people have problems because it's usually at or above shoulder height, you can do a similar type of test here, barring there's no pain and they can hold a natural position, where then I try to push inward and we see how well they can hold. If they shrug, basically, can they actually hold that external rotation posture? We can also change line or plane, and we can do it here as well. So bottom line, we can be creative with our manual muscle test. It doesn't have to just be below shoulder level.